Thank you, everybody, and for giving us this huge opportunity to share everything that's so wonderful about this programme and everyone involved in it. So just for this section now, I'm just going to take you through our work a little bit, and I'm going to share some slides, if that's okay. So I'm just going to do that now, and hopefully you can see that. Can you see everything there, James and Timmy?
Mm-hmm. Yep.
Okay, so here we are with Let's Grow Together, the new organisation. And I suppose what's already been said already today, this is about working with everybody across the community who come into the life of children. So we support everybody around the child as such, especially the most important people, the caregivers, parents, the wider family, but also, I suppose, other people like early years providers, nurses, practitioners, teachers. So it's that kind of whole community wrapped around children as they grow from the very start of life. Some of the themes and I suppose processes, with a little bit of jargon here, but I'll just try and take you through it a little bit. This is area-based, evidence-based prevention, promotion, and early intervention approaches to working with children, families and services. There's a whole area of our work which is about direct services, so what we can offer directly to families and their infants primarily. And then when they start going to preschool, so we work with the children and parents in their homes and in the community. They're the most important people. And then after that, the next important place after the child's home is in the early years services. So we then support those early years services and then on into schools. And it's so, again, it's about everybody along that continuum supporting children who support and come into the lives of children. So that's where we talk about the capacity building element of the programme. And this is about sharing skills and knowledge and resources, and so allowing everybody to have that information and skills development. And we support people through education, training and mentoring. We have everything that underpins our work from every aspect of the programme we do. It's all about, I suppose, infant mental health. I suppose that's the essence of what we're about, the capacity for children, babies to start to interact with their world, to communicate, to regulate their emotions. And that sets us up, I suppose, in our lifelong journey to cope with the normal stresses and strains in life. And they have that opportunity to build that resilience from the start of life. Our approach is absolutely relational. I suppose it's built on respect and I suppose understanding that everybody is doing their very best with the existing knowledge and skills and resources they have. And all we're trying to do is add to that and notice where things are going really well and to build on that. And it's empowering others. So it's not about us. If we weren't here tomorrow, I suppose what was left behind. So we want other people to have that knowledge. The next piece then is around integration. So working in partnership with everybody, as we said, and I suppose there's up to 50 other services and organisations working with us. And I suppose we're supporting change in systems and practice for children. The next area then is this evidence base. So everything we're doing is informed by, I suppose, the science and practice of everything we know about children's development and what they need to support the relationships within their lives and the environments that are important to them. So, you know, we're interested in the school rooms, in the preschool rooms, and in the parks and the communities and homes as well. A big part of our work as well is about monitoring and evaluation and building our evidence base ourselves for what we're doing here. So we're bringing all this knowledge and skills and resources, and we want to know what works here too. So we have 4 interconnected, I suppose, strategies within the programme. The first one being infant mental health and wellbeing. Speech, language and literacy is the second. The third is early years childhood care and education. And the fourth is pro-social behaviour and self-regulation, which is a total mouthful, but really it's about our schools programmes here. And these are the ages and stages, I suppose, that we're focused on. So within the infant mental health and wellbeing programme, we have one-to-one, so working directly with families, and we have group offerings within the community. And I suppose it starts in pre-birth, and we have a home infant mental health home visiting programme that's available up to children of 3 years of age, supporting children, babies' relationships with their primary caregivers within their own home, and to support that relationship develop and grow. And what really complements that now, and we'll hear more about this later, is the newborn observational tool. We also provide support to Dr. Louise Gibson's Kidscope Child Development Clinic, which is here in our community. And we are also offering prenatal groups for parents, mums and dads and partners, to include all of those people within those that kind of preparation for parenthood. We also have baby massage, Peeps 1 to 2 and 3 to 4, Let's Talk with Your Baby by Elkland, and the Circle of Security programme as well. So a lovely suite of evidence-based programmes that parents and caregivers and the wider community can engage with. The next area then is the capacity building. So this is for practitioners across a whole range of services that are available, and we want to share this knowledge, I suppose, with everybody. So we have infant mental health introductions and masterclasses. We're currently delivering infant mental health training and a mentoring programme in early years services. We offer, and we have offered and will again, the newborn observational tool training. And as we said before, the antenatal group training. We are offering, I suppose, infant mental health workshops within the community this summer. And I don't like to name many people because you always miss people out, but we've had a lovely collaboration with the Geistucht around the workshopping the Resilience movie, which you're probably familiar with. Next area is speech, language, literacy and communication. And I suppose what's wonderful about this is we have our speech and language therapists working with our infant parent support workers, public health nurses and infant mental health coordinators in the home visiting and in the group processes. So this is an amazing opportunity for speech and language therapists, I suppose, to work in the preventative space, not necessarily, so moving from the kind of primary care space into prevention. So they have an opportunity to support and promote language development from the very earliest opportunities in a child's life. And then later on, they meet babies in the public health nurse clinic at Babbling Babies, promoting books, singing, interaction, relationships with babies, and that kind of play and interaction that really supports children's communication. And then our oral language officers have a kind of a whole suite of capacity building programs like Hannon ABC and Beyond, Hannon Learning Language and Loving It, and the Hannon I Am Ready program for parents, and communication workshops in the community and in schools and preschools. They also provide a huge amount of consultations and I suppose navigating and supporting practitioners and parents around existing mainstream services. And I have a lovely picture of Dolly Parton there because we launched the Imagination Library last year with, I suppose, eligible for 3,000 children in Cork City and County to receive a book a month from birth until the age of 5. So creating a really positive relationship with books, with language from birth. And I suppose we're leading that with a huge interagency partnership group as well. The third area of work is the early years care and education strategy. So again, the environmental rating scale here is used to kind of measure and monitor what we're doing in supporting early years services right across the community. And we offer, I suppose, curriculum training, environmental resources to kind of support and adapt environments. They take on a lot of our, I suppose, capacity building services as well. So Hannon programs and the infant mental health training and mentoring. I suppose this strategy is all about empowering and building on, I suppose, early years services commitment to children and the huge value that they have in children's lives after the home environment. And it's building, I suppose, their capacity even further around interaction with children, because we know they make a huge difference to children's lives, and we really value them and want to support them in their work. So we work very closely with them. Again, the same with schools. I suppose Dave mentioned the schools very well there, and we work very closely with Ingrid O'Riordan and the school completion team in our area, and just to pay tribute to them as well. And we have the Suite of Incredible Years programmes available to schools. That's the parent programme, the teacher classroom management programme, and the classroom diner. And I suppose embedding that even further, local principals and teachers have done the training themselves to be trainers, to be leaders within their own communities. So that's building the resources and keeping them here. Again, all the Hannon programs are available as well to support language and communication. And we're hoping to bring in the Doodle Den from our colleagues in CDI Tala into our community very soon as well. So that's the 4 strategies essentially. And just to say as well, a lot of what we do, I suppose, goes beyond our own kind of direct area, and we're working across Cork City and nationally around a number of different networks and work groups, I suppose, promoting early intervention and prevention, the concepts of things like play, health and well-being from the start of life, learning in terms of lifelong learning starts at the start of life. And I suppose we're very willing and participants in a number of different, I suppose, forums to support other people's work and our own. And just to acknowledge as well, UCC, who have had a mention as well today, they're our kind of research partners, and we have a group of people supporting us within UCC as well, to, I suppose, further develop an understanding of the work, the needs within the community, and the impact of the programme. The area-based childhood programme is the programme that we're nationally engaged with, and there are 12 other sites in the country, I suppose, that we have a great honour of, I suppose, engaging with nationally, and that is part of, as Dave said, the PPFS programme within TUSLA. So that's the kind of landscape. The 5-year strategic plan, which the Taoiseach mentioned here, I think it's going live today on our website, really plots our way forward, our commitment and value to including the voices of children within our work and planning, and the voice of all our stakeholders. We're moving into new premises very shortly, thanks to our housing and to the City Council. We're really looking at sustainability and I suppose, the development and growth of the Young Knocknaheeny programme here. So, and underpinning all of that is our new Board of Management, who I suppose have taken on the programme to see it into the future, and they're very interested in, I suppose, good governance. So that's essentially the wider programme. But I suppose at the bottom, I suppose at the heart of all that are children and babies.